Good morning, everyone. First of all, I thank the organizing committee of this MARPCON Latur 2023 for giving me this opportunity to be on this side of the dais. So today I will deal with the recent burning topic of notifiable diseases and Indian laws. Why this topic is chosen? Because post-COVID, there are many mutations in the strains, and there are many new risings of the epidemics like measles, and new cases of diphtheria, tetanus are emerging very much. So we want to see which are the notifiable diseases and what are the Indian laws regarding it. So aims of this presentation are to know what is notifiable disease, what is notification, why to notify, when to notify, whom to notify by who, and what are the laws regarding it. So first, coming to the definition of notifiable disease, any disease that is required by law to be reported to the government authorities. So notification is a practice of reporting the occurrence of specific disease or health related condition to the appropriate and designated authorities. So coming to the history of notification, the first disease which was notified was plague in 17th century in Britain. Second was cholera in 1848, and followed by third outbreak of influenza. Later many outbreaks were there like smallpox, polio, and to the present scenario of COVID-19 and now emerging measles. So why to notify? So because the diseases are highly infective in nature, the severity of disease, that is potentially for rapid mortality, its communicability, its potential to cause outbreaks, the socio-economic cost of its cases, provides valuable information regarding the course of the disease, then allows authorities to monitor the disease, provide early warnings of possible outbreaks, and implement appropriate measures. So list of the notifiable disease. Like the picture in this slide, definitely it is surprising that there are many diseases which are to be notifiable and which we are not known. So really it's a surprise. So the notifiable disease vary from country to country, within the same country, between the states, between the urban and rural areas. So these are categorized into Group A and Group B. Group A, these are very dangerous diseases like cholera, plague, yellow fever, and just we face COVID-19. These are very dangerous because they have aggressive spreading nature and create havoc like the tsunami shown in this picture. So these should be informed within 24 hours by telephonic communication or by fax or notification form. The standard form used for notification is called H55. So Group B diseases, these are those diseases which spread slowly, but they are definitely can create devastating situation like the floods. So the diseases including in these are acute flaccid paralysis, chickenpox, dengue hemorrhagic fever, dengue, diphtheria, dysentery, encephalitis, enteric fever, food poisoning, human rabies, leptospirosis, malaria, mumps, measles, meningitis, rubella, congenital rubella syndrome, SARS, tetanus, neonatal tetanus, pulmonary tuberculosis, typhus fever, viral hepatitis, and whooping cough. So coming to the structure of the notification system, there are different surveillance units at three levels: district level, so district surveillance unit, then state level, state surveillance units with state and union territory headquarters, and central surveillance units at Delhi. So objective is to strengthen the surveillance in the country. So when to notify? As soon as the provisional diagnosis is made, if telephonically or by fax within 24 hours, and if in written format, it should be informed within 72 hours. But remember one thing, it should not at all informed on discharge. So who should notify and to whom should it be notified? So medical officers play the primary role in notification, but it is applicable to both private and public hospitals, primary, secondary, tertiary care hospitals to the medical colleges. They notify to the local health authorities like municipal corporations or civil surgeon offices, and from there is deputation of health inspector, and then the field visits are done and executes preventive measures. To whom acute flaccid paralysis cases should be notified to? Ministry of Health, epidemiologist and regional epidemiologist by telephone, fax, AFP notification form. Tuberculosis to Director, National Prevention of Tuberculosis Control and Chest Diseases by TB notification form. SARS COVID-19 to DGHS, DDG, Director, Quarantine, Port, Airport Health Officer, Epidemiologist and Ministry of Health. So others to the Ministry of Health of the area of residence by notification form. So mechanism of data collection. So medical officers collect the data. Data is collected from hospitals, from inpatient registers, medical statistical units, special campaigns. At the local level, they are informed to the regional epidemiologist at district levels and epidemiology unit at central levels. So these are the various notification forms for measles and rubella. This is for acute flaccid paralysis, hand, foot, mouth disease. So disease reporting at national level, Council of State and Territorial Epidemiologists. At state level, state report morbidity data to CDC, which is published weekly in Morbidity and Mortality Weekly Report. So limitations of notification. So it is under-reporting, poor quality of reporting, then lack of timeliness, inconsistency of case definition, lack of representativeness of reported cases. So take an example of measles. Many cases which are managed at home only, they are not at all reported. From general practitioners, many are not reported, may or may not be reported. Government hospitals, usually they are reported, but private hospitals, we don't know the percentage of reporting. So misconceptions. So this is the basic crux of hindrance in notification. So some famous Marathwada scenarios and dialogues with Laturi Tadka we will see. Wrong judgment that disease is not serious. For example, patient चाई म्हणते गौर तर आहे, तेला पाण्याची आंघोळ घातली की कमी होऊन जाईल 4 दिवसामध्ये. So pseudo experts misguiding the people. For example, corona, whether it exists or not, is still a research. So patientचा नातेवाईक, सरपंच खरं सांगा बरं, करोना आहे का नाही? सरपंच, करोना बिरोना काही बी नाही, उगा नाकात काड्या घालायच्या, भिव घालायचं, निस्ता बाजार मांडलाय सगळ्यांनी, ब्रॅकेटमध्ये पैशाचा. दिस इज द लोकल scenarios which we are dealing or seeing. So reporting breaches confidentiality and compromises doctor-patient relationship. For example, after notification of COVID-19 and isolation in quarantine centers, उगच उगच सांगितलं बरं डॉक्टरनं, समध्या गावाला कळलं आता मला करोना झालाय, किती त्रास, आता त्या डॉक्टरचं कधीच तोंड नाही बघायचं. I believe that health department does not act on the reports to the extreme belief that they don't work at all. So सांगून पण काय उपयोग नाही, काहीच काम करत नाहीत, फुकटच्या पगारी उचलतात. So just a part of humor, but the ground level of genuine problems are all these. So Indian laws, the Epidemic Law Act 1897, it is the Quarantine and Prevention of Disease Ordinance of 1897 and its amendments. Every practitioner treating a case of notifiable disease should notify. Anyone failing to do so can be prosecuted in the magistrate court. So punishment under the section 188 of IPC 1860 with the imprisonment of 3 months which can be extended up to 5 years. Fine of 50,000 which can be extended up to 1 lakh rupees. So section 269 of IPC, negligent act likely to spread infection of disease dangerous to life shall be punished with imprisonment or description for a termination which may extend of to 6 months or with fine or both. But one good thing is it's a bailable offense. So section 270 increases the penalty to up to 2 years and or fine when the act is malignant. So this is the important topic regarding notification, tuberculosis. So mandatory TB notification gazette for private practitioner, chemist and public health staff under revised National TB Control Program, steps towards ending of TB in India. Till now, only medical practitioners, hospitals and laboratories were notifying the TB patients to system. Now, chemists will also implement Schedule H1 and inform patients for whom they are dispensing drugs. TB patients are themselves encouraged to notify themselves. Every TB patient has to reach the local public health authority, namely DHO or CMO or district municipal health officer of urban bodies. So, incentives for TB patients: nutrition support in the form of rupees 500 per month during treatment for busy practitioner and chemists. If they notify online, web-based and mobile application named Nikshay, so rupees 1000 per TB patients, 500 rupees on notification once verified and 500 rupees on completion of the treatment. But if we don't report on time, or the punishment is, if failure to report TB cases, there is imprisonment for up to 2 years. So COVID-19, this is a good law for doctors. Epidemic Act in light of COVID-19 epidemic diseases, Amendment Ordinance 2020. The ordinance is in favor of healthcare personnel, including doctors, nurses, etc., who carries their duties by putting themselves at risk of contracting the injurious disease. Any harm, injury to them by a person will be punished with imprisonment of 3 years to maximum 5 years and fine of 50,000 to 2 lakhs rupees. So the take home message: we should know the notifiable diseases, notify promptly, timely notification will help early intervention. Healthcare personnel must be adequately trained to identify and notify the disease. Laws should be known, and your little effort can save you, your family as well as your society. So this is my lovely Department of Pediatrics, VDGMC, Latur. Thank you.
Thank you, sir. Thank you for enlightening all of us on such an important topic.